So here's the question. Is there someone missing from your family's healthcare team? Is there? Well, Dr. Alan Miner of Health Quest Chiropractic may be the missing piece of that puzzle that you were trying to put together.
I think so.
Welcome back, Dr. Miner.
Hi, good morning.
Love to have you here.
Great to be
So
here.
you're the missing piece to the puzzle. That's pretty cool, huh?
Yeah.
That makes you very important.
You know, a lot of people don't think about that. They have their pediatrician, they have a dentist, and the chiropractor can oftentimes be the missing link.
That's right. I want to talk about the biggest misconception about chiropractic practice, because I don't think a lot of people realize why it's such an important part of that mix.
Well, if we're honest, there's a lot of them, right?
Okay,
I mean,
yeah.
everybody's heard, you know, they're going to crack my neck,
Right.
could hurt me, maybe chiropractic, if you're in a car accident or if you have some sort of maybe a back problem. Those are all things that we help with, but they're actually a very small part of our practice.
That's right. I mean, that's the thing. I don't think people realize that, but you do so much more than that. I mean, you've talked about everything from how to prevent getting the flu to how to get more sleep and why it's so important. There's so much to it. And also, I want to talk about the fact that chiropractic is also considered conservative health care. So I think that's another thing people think. What does that actually mean, though?
Well, what we teach is chiropractic first, medication second, surgery third, because you can always take the medication. You can't undo the surgery once you've done it.
That's
but
right.
so oftentimes chiropractic, it's conservative. It's, you know, if it doesn't work, then you still have those other options.
Right.
But so often it's effective. And you know, what's beautiful about chiropractic is we're not putting anything into a person's body. We're not taking anything out. We use our hands. We bring a person's body into alignment, and all of a sudden their body starts working at a higher level. And so oftentimes things that people never think about a chiropractor helping with, those problems are resolved. So
It's amazing. I mean, let's talk about some of the types of conditions that you actually can help with.
Sure. You know, I guess the list is long, and what I'd first say is we do a pretty good job of documenting the changes that we see. So I'd encourage people to go, the viewers, to go to our website at newmexicochiro.com. We have a lot of testimonials. Also, our YouTube channel has testimonials. Literally just about every condition you can think of, we've got somebody with a story on there. Things like rheumatoid arthritis, dermatitis, and scleroderma. You know, people who suffer from severe allergies or migraine headaches, seizures. You know, the list goes on, and I have to explain why. It's because we're dealing with the central nervous system, and that is your brain and spinal cord are your body's lifeline. It runs everything that your body does.
That's true.
And
we really don't think about it that way.
No, and so if there's an interference because your posture shifted, that can have a profound effect on your health. And so that's why we say a chiropractor needs to be part of a family's healthcare team, because a family is so much healthier when everybody's getting adjusted regularly.
Right, and speaking of families, a lot of the work you do involves children. So why would a child need to be adjusted?
Yeah, and you know, I think a lot of times people get that mental image of us adjusting a child like we would an adult. An adjustment for a child is so gentle. I mean, just a couple pounds of pressure.
Really?
But it starts at birth. You know, especially if a child's born in a hospital where there's any kind of pulling, which is common today. Yeah, breech births, C-sections, vacuum births. Right away from the moment that child comes into the world, there's been stress put on their spine. Then you look at the average child, they fall something like 2,000 times in their first couple of years.
Yeah.
I have kids, they're diving headfirst into the couch. You know, I mean, it's just part of being a child in the world we live in. And then let alone if you have a sports injury, a car accident, any other kind of a fall. That's why we see so many families. We also see a lot of families who've struggled with health problems. They're tired of the ear infections. They don't want to put tubes in their kids' ears. Or we have families who have put tubes in 3 or 4 times and said, this is insane. We've got to find something else. Kids with asthma. And so chiropractic can be a great solution for these families.
Really, it can. I mean, and like you said, it's not medicine first, it's not injections, it's not surgery. You don't jump to that stuff first. You take a look, you see what you can do with your hands first. And it's really a hands-on approach. And I think some people wonder, you know, would I have to have a certain symptom to have my spine checked in the first place, or should they just come in? What's your recommendation?
That's something that we really recommend everybody get their spine checked.
Okay.
And think about it. Most people have had their blood pressure checked, their cholesterol, maybe a mammogram, maybe you've had, you know, you name it. There's checkups for everything, but our spine gets neglected. And so just to have that baseline for the health of your spine is important. And it also gives us insight if you do have an accident later on down the road. If something happens, now we know where you were.
Wow,
so
I didn't think of it that way.
That's documented now. So it really is critical that people get their spine checked.
That makes a lot of sense. And then as you get, you know, moving through the months and through the year, do you know, when we say checkups, we usually do annuals. How does it work with adjustments? Is there a regular checkup, or?
Yeah, it depends on what's going on. And so what we do is we start with the checkup. Okay. And then hopefully we report the good news, or if there's challenges, then we can talk about that.
Before it gets worse.
Exactly, and then talk about the best course of action for that person.
That's great.
But we do recommend, it depends on lifestyle really, typically an annual checkup, unless somebody has, maybe they play a sport where there's a lot of trauma. Another big one today, Nikki, is sitting. I mean, people who sit at desks for 40 hours a week have some of the worst spines we see.
I bet.
It's kind of both ends of the spectrum, but our posture is, it's the window into our health, and it's our lifeline to our body, so we got to put emphasis on.
Well, I have to get my spine checked, but I have been watching my posture ever since you told me that. Good. I've been much more cognitive of such. Now, I want to remind all our viewers where you're located.
We're over in the Journal Center. We're off of Masthead, which is a street off of Jefferson. And our website's the best way to find out about us and see some of those testimonials we're talking about at NewMexicoChiro.com.
Fabulous. Dr. Meyer, so good, and it's fun to have you on a Friday.
Thank you. Yeah, nice mix, change of pace.
Yeah, I wish you a happy weekend, and thanks for the great advice as always. And coming up next, the new face of Gertrude Zachary is revealed. Don't go away.